Good morning, ladies and gentlemen, and welcome back to the course on sports training, load management, and recovery. This is lecture 4 of week 6, and we will be discussing a very important topic in sports training called recovery in sports. My name is Colonel Dr. Anup Krishnan, and I am your instructor for this week. I will be covering the course as per the following outlines: definition, introduction, components, importance of recovery in sports, physiology of recovery, types of recovery, factors and markers of recovery, some practical tips, and we will end as usual with a take-home message. Bishop et al. In 2007 defined recovery as the ability to meet or exceed performance in a particular activity. Recovery from exercise training is an integral component of the overall training program and is essential for optimal performance. If the rate of recovery is improved, higher training volumes and intensities are possible without the detrimental effects of overtraining. Understanding the physiological concept of recovery is essential for designing optimal training programs. However, variability exists within the recovery process due to training status, fatigue, and the ability to deal with physical, emotional, and psychological stressors. That means the recovery process is different for different individuals. There are some components of recovery, or basically what does recovery comprise of? Normalization of physiological functions such as blood pressure, cardiac cycle, etc. Return to homeostasis for the resting cell environment. Restoration of energy stores like blood glucose and muscle glycogen. And replenishment of cellular energy enzymes. When all these four things happen, we can say that recovery is complete. Recovery may include an active component such as a post-workout walk or a passive component such as a post-workout hydrotherapy treatment. Recovery is very important in sports, and the reason is that recovery allows the body to repair damaged tissues, replenish energy stores, reduce fatigue, and to restore the hormonal balance. A well-structured recovery regimen enables athletes to maintain consistent performance, avoid overtraining, recuperate mentally, enhance skills, and reduce injuries. Muscle recovery occurs during and primarily after exercise and is characterized by the continuous removal of lactate and hydrogen ions. During the exercise, recovery is needed to re-establish intramuscular blood flow for oxygen delivery, promote replenishment of phosphocreatine stores, restore intramuscular pH and the acid-base balance, and to regain the muscle membrane potential, that is, to restore the balance between the sodium and potassium ions inside and outside of the cells. During post-exercise recovery, there is also an increase in excess post-exercise oxygen consumption, or EPOC. Recovery includes the return of ventilation, blood circulation, and body temperature to the pre-exercise levels. There are several types of recovery. Immediate recovery occurs during the exercise itself. Simply put, when you are running, one limb is active, the other limb is recovering. That is immediate recovery. Short-term recovery involves recovery between sets of a given exercise or between interval workouts. If you are doing a set of biceps curls and you rest between the sets, that is short-term recovery. Training recovery is the recovery between workout sessions or athletic competitions. You had a workout session today, you rested for 24 hours, that is your training recovery. You had a competition today, you rested for 3 weeks, that is your training recovery. There are 3 main types of recovery in sports: active, passive, and long-term recovery. Let's take each one in detail. Active recovery involves engaging in low-intensity exercise or any movement that promotes blood flow and aids in the removal of metabolic waste products. This form of recovery is beneficial for restoring muscle soreness, improving flexibility, and restoring energy balance. Examples include light jogging, swimming, and yoga. Passive recovery entails complete rest or inactivity, allowing the body to recuperate naturally without any additional physical stress. This type of recovery is essential for tissue repair, immune system support, and mental rejuvenation. Examples of passive recovery include sleep, relaxation, and meditation. Long-term recovery refers to scheduled periods of reduced training volume or complete rest which are incorporated into the training program to prevent overtraining and burnout. These deload or taper weeks help the athletes to adapt to training stress and achieve peak performance during competitions. Example includes off-season breaks and rest days within training cycles. There are several factors which affect recovery. They are muscle soreness and weakness, poor exercise performance, decrease in appetite, increased infection, quality and quantity of sleep, and gastrointestinal abnormalities. There may be some markers for recovery, and the best marker for recovery is something called performance marker. Basically, has the athlete been able to come back to his earlier level of performance? If he is able to, he has adequately recovered. You may also have biochemical or muscle status markers such as creatine kinase and troponin I. Let's talk about some practical tips for recovery. If you are asked the question, how much rest between sets? The answer is depends on what you are trying to train for. If you are trying to train for muscular endurance, 30 to 90 seconds between sets. If you are trying to train for hypertrophy, 1 to 2 minutes between sets. If you are trying to train for power, it's 3 minutes between sets. And if you are going for maximum strength or muscular strength, it is 4 to 5 minutes between sets. How much rest between sessions? The greater the stress of the workout, the greater the overall muscle recruitment, and the greater the potential for muscle damage and soreness. Therefore, the need for recovery time will be longer. Muscle recovery between resistance training sessions for most individuals is also influenced by other types of training performed. How much rest between sessions? Ria et al. In 2003 concluded that for untrained and trained individuals, 1 to 2 days rest between sessions is ideal. This will also vary depending upon the total volume of resistance training, individual training status, and overall goals. Example, if you're training for hypertrophy, if you're training for strength, if you're training for endurance, etc. Do different muscle groups need more rest? Yes. If you're doing ground-based movements such as deadlift, squat, and overhead press, they will require more rest than if you're doing smaller muscle groups like biceps, triceps, and forearm flexors. This is due to the increase in motor unit recruitment and larger muscle mass which is involved with these larger multi-joint exercises. So yes, if you are using more muscle groups, you will need more rest. Is there a gender difference in recovery? Yes, because there is a gender difference in fatigue, there is a gender difference in recovery, because fatigue directly influences recovery. There are several studies which have shown that fit women have a greater resistance to fatigue than their male counterparts. Therefore, fit women are able to sustain continuous and intermittent muscle contractions at low to moderate intensity longer than physically active men. So yes, at low to moderate intensity, when women are more fit than men. So let's talk about the take-home messages. Recovery from training is one of the most important aspects of improving athletic performance. You have to give your athlete time for recovery. Otherwise, he is going to go into overreaching or overtraining. This is a sure shot formula for disaster if you do not give your athlete time for recovery. Effective training recovery strategies are specific to the individual athlete and they are to the point during the competitive season. That means they should be specific and they should be to the point during the competition. Coaches may experiment with different techniques for their athlete, but the experimentation should be done during training and should not be done during the competition. Coaches should also provide individual and group responses for training recovery strategies for their individuals, and they may also provide group training recovery strategies also for their teams. These are the references which have been used in preparing this lecture, ladies and gentlemen. I strongly urge you to go through them in the interest of better understanding and better knowledge of the subject. I have finished, ladies and gentlemen. Do let us know your comments and questions in the email flashing on the slide. Thank you, ladies and gentlemen. Thank you and Jai Hind.